And so I'm Howard Chansky. I'm the chair of the Department of Orthopedics and Sports Medicine. And I am really excited today because two of my favorite residents are back visiting us. I'm actually going to have Pooja Prabhakar do the introductions. She's put a lot of work into organizing grand rounds this year. And if you recall, we had Eli Powell several years ago. Eli was a resident here about 30 years ago, and he talked about his perspectives on private practice. And Thea and Waqqar, they're about 15 years or even a little more later, so almost a generation after Eli. So I'm excited to get a different perspective. And obviously, they're a married couple who both were or are practicing orthopedic surgeons. And, you know, in our department, we have hardly anybody who's spent time in private practice. I see Dr. Wagner there. He may be the only one that I can think of off the top of my head. And so it's, oh, well, okay. Yeah. Sarah and Chris also, that's right. So it's really exciting. It's something that we can't really give you, great perspective on, although I guess we do have maybe the only three here. And I think of Northwest as sort of being part of us for, so long now. So anyways, with that, I'm going to introduce Dr. Prabhakar, and she's going to introduce our special guest today.
Thank you, Dr. Chansky. Hi, everyone. My name is Pooja Prabhakar. I'm a fourth-year orthopedic resident here, and I'm honored to introduce today's grand round speakers for this morning, our program's very own alumni, Dr. Waqqar Khan-Farooqi and Dr. Thea Wojtkowski. First, we'll hear from Dr. Waqqar Khan-Farooqi. He completed his undergraduate degree at Stanford University and worked in a cancer biology research lab for 2 years after graduation. He stayed there for medical school, then moved to Seattle to complete his residency here at the University of Washington, graduating in 2005. He then went to OrthoCarolina for his foot and ankle fellowship, and he now practices at the Steadman Clinic in Aspen, Colorado. Our second speaker, Dr. Thea Wojtkowski, also attended Stanford University for her undergraduate degree in biology and worked in a research lab there for a year after graduating, investigating heat shock proteins and their relationship with type 1 diabetes. She then came to the University of Washington for medical school and stayed on for her orthopedic residency, graduating in 2004. She practiced orthopedic trauma surgery and hip surgery at the Steadman Clinic until her retirement recently. Please join me in welcoming our alumni to hear about their wisdom and experiences in managing life in private practice. Thank you.
Thank you, everybody, for being here. It truly is an honor and a pleasure to get to come back here. Super excited. I've been anticipating this for a long time. Starting with disclosures, Tia and I have none. You may be wondering, like I am, why a guy who you've never heard of, who hasn't published anything, is on his fourth job in private practice, is sitting here talking about how to make it work. And to be frank, I'm not sure either. If you figure it out, let me know. I suspect it's because I've had the good fortune and opportunity to learn from the best. I truly feel that way. And I've got the mother of all teachers that keeps teaching me, and that's experience and mistakes. And I hope at the end of the time that I speak to you, you have the opportunity to be successful and happy in whatever you do, but maybe not make as many mistakes as I did along the way. As mentioned, I started here at the University of Washington as a resident, where for the first time in my life, I learned what hard work was. And it was a lesson I really, truly hadn't learned and tried to avoid, despite relative success academically in my life. I learned that to make it work as a resident to survive, I had to work really hard, harder than I really felt comfortable for a little while, but then became part of the flow. The other thing I learned in retrospect in preparing my comments was everything that I did learn to make it in residency, to survive, make it, thrive, whatever, were all things that have taught me how to survive and thrive in private practice. But I kind of tried to get away from it because residency was a challenging time. And I remember leaving thinking, I'm so glad I did that, but I never want to do that again. And so private practice, I didn't want it to be a recreation of my residency. And then in hindsight, I'm now very happy and confident and comfortable in what I do. I look forward to going to work. And I think it's because I've gone all the way back to the first principles. Those principles are, number one, of course, hard work. Number two, it's surrounding yourself with people you respect and enjoy, and making sure that you make it a point to respect and enjoy the people that you are surrounded by. You sometimes can't choose. Be very, very careful with the soft tissues. It's a lesson that you learn here that, trust me, not everybody does. And when you do, you can be a success. The other thing I learned is that intermittent fasting is really good for your health. I missed a lot of meals in training. I still do. And my metabolic profile is better than some of my buddies. I went on to Charlotte, North Carolina, so I could fulfill my dream of being involved in pro sports. I'm not quite the athlete I'd like to be. So I tried to take care of the athletes and truly what I wanted to be the Northwest version of Dr. Anderson, who's considered the sort of go-to guy for professional sports consulting for foot and ankle injuries. And I told him that early on in fellowship, said, I want to be you, but I'll be far away, so don't worry about the competition. And about 3 months in, he sat me down and said, Waqqar, you don't want to be me. You don't want my life. I've been consumed by my job. I can't say no. I don't know my kids. It's early for you. It's not too late. You have ambition. You have drive. Don't let this job consume you. Otherwise, you won't be able to walk away from it. I want you to know your kids. I took that to heart. And rather than come back here, which was my intention, I actually, through a lot of counseling with Dr. Anderson, decided to take my first job in private practice at Swedish Orthopaedic Institute as part of a 17-person group in private practice, not too far from here, where I learned that orthopedics is a business. It's a business for us. It's a business for the people who employ us. It's a business for the hospital. And if you don't manage the business, if you're not acutely aware of the fact that it's a business, it can be a very, very difficult ride. For family reasons, we decided to move to Grand Junction, Colorado, where coincidentally, Dr. Githens' brother is currently in practice. It's a level 2 trauma center. There's nothing nearby, and sometimes the weather forces it to where you can't transfer patients. So we function like a level 1, didn't have orthopedic traumatologists. So it sort of cut my teeth. And again, going back to first principles and trauma again. And there I learned that not everyone is trained the way we are. And you have to kind of not worry about what other people are doing, and really focus on what you learned and what you know is right and stick to it. And if you do that, you're going to be a superstar almost instantly. Again, for family reasons, we moved on to Aspen, Colorado, where we live now, surrounded by the rich and famous, quite literally. I mean, it's absurd who we meet, who we see, who we have dinner with. And it's taught me a lot about what's important to me in life, because maybe going in, I wasn't quite so sure that the finer trappings in life weren't for me. Our initial job was hospital employed. We were 6 of us taking a very busy call, particularly in the winter, where we would get anywhere from 0 to 10 fractures a day, no distinction between weekends and weekdays because people are on vacation there. And you got to run your daytime practice, and then you've got fracture after fracture stacked up. And again, hard work and first principles and trauma really made Tia and I both a success. Unfortunately, likewise, we weren't necessarily surrounded by people for whom work was the priority. It's Aspen, Colorado, after all. And we got bought out by a private equity group-backed venture called the Steadman Clinic, which I'm sure you've heard of. They did not intend to keep anybody. They wanted to bring their own people. That's what they do. But Dr. Philippon sat me down in a room and told me that by virtue of our training, the fact that we had come from the University of Washington and that the reputation we had was that we were hard workers, he kept us both on because of our reputation in the community and because of our work ethic. And I just saw him again on Friday. And I'll tell you a little bit later about what came of that conversation. I've listened to a couple of grand rounds before just for a template, and I listened to one on sleep hygiene, which was super valuable. I'd read this book before, so if at any point I'm boring you or you're sleep deprived, feel free to sleep. Before you do, this is the punchline of what I'm going to say. These are the principles, and they're big picture principles. They're not really, this is how many patients you should see, or this is how many surgeries you need to do, or try to ask for this much dollars per WR view. It's again, going to sort of a more philosophical big picture standpoint. I'm under no illusion that work is fun for really anybody at all times. And admittedly, there were times where if I took the right test, I would qualify as having been burnt out for some amount of time. And during those times, I sort of thought maybe it's orthopedics because it is hard work and you're not always getting the reward you seek. And frankly, it's painful at times. And I thought if I left ortho, I was going to write or I'd be a rock star. Problem is I can neither write well, nor can I sing well. And it's absurd as me to think that I could be a rock star as a rock star. I think they could be an orthopedic surgeon. There's these Labor Day concerts at Outdoor Festival where we'll get several big name acts that come every year. And they come on Labor Day. It's a mile walk from our house. And for about a 4-year period, either Tia or I was on call. And we weren't really able to be present. And I felt like I was really missing out on something important because I actually am a huge fan of music. I reviewed hip hop music for my school paper in college and really got into music and particularly hip hop at that time. And wouldn't you know that it would be a country star that happened to be the headliner the one year that neither Tia or I was on call, and I could actually be present. But I'd made it a point to be present and actually listen and not worry about who the star was. And halfway through the set, in the first chord that he played, I could tell that the song had something emotional about it that sort of resonated with me. And wouldn't you know, he sang a song about being burnt out. Here's a guy with 10,000 people who had waited hours to see him play. He sounds amazing. He's doing what seems lovely, and he's burnt out. And you know, it reminded me that burnout's not an illness, it's not weakness, it's the universal human response to being exposed to repeated noxious stimuli that you can either control the pace of, the frequency of, nor the intensity of. And so my plan to be a rock star really wasn't the right one. Oscar Wilde's definition of an expert is a common man that's far from home giving advice. So that's what you're about to be exposed to, an expert on private practice. And the first point I want to give you is before you even start setting your life up in practice, and again, how many patients am I going to see, how many surgeries, big picture, make the big picture life plan. Otherwise, you might end up somewhere where you don't really want to be. And that did happen to us at some point where we were just doing what you're supposed to do when you graduate residency, get married, have a family, raise them right, make them do sports, et cetera, et cetera. And you look up and you're like, is this really where I wanted to be and what I thought we'd be doing? And if you construct that life plan deliberately and make it intermediate to long-term and not just short-term, and you honestly think about things like, what kind of mortgage do I want? Do I want to live in a condo in the city? Do I want a house on the farm with chickens? Be really specific, engage your partner and your family and people that are important to you. Because with that, you can then build the life that you want to build. And what you'll see from our different comments is that it's not going to be the same for everybody. And there are times when it's going to change. The other thing that's important to note is that right now, there's a lot of talk about happiness. And people will tell you that work is not the place to find happiness, that you shouldn't define yourself by your work, work to live, don't live to work. And I don't personally believe that that's doing anybody any justice. Those aphorisms rob us of the ability to find joy in what we do. And as orthopedic surgeons, we actually get to do something super joyful. And I'll argue later that really is the core of what makes a person happy at work. I think the issue is that we think that labor, that working hard, that somehow you're being cheated if you have to work hard, or if you're not working the least and making the most money, somehow you're a sucker and you're losing in life. And that's just fundamentally not true. We are wired to be successful and to want to be helpful. We're similarly wired for that to take effort. It's just us as human beings. And even poets understand that you can't just sit around and look at your navel all day. You've got to actually do some labor. And I think the reason is because we conflate different types of happiness and put them all in the same word. The ancient Greeks were a little more sophisticated about fulfillment and happiness than we are, and they use different words for it. Excitement, satisfaction, they're not the same thing, but we think about if we're going to be happy at work, it should be exciting. And that's more hedonic happiness. That's more listening to a song or having a great glass of wine. And that's not really what you get out of work. What you get is the sense that you're fulfilled. And this is something I had to learn myself, again, living in Aspen, is that while everyone else is out skiing, I'm in fixing a fracture that one of their colleagues had. And that happens over and over. I take 120 days of call. There's only 3 of us right now sharing call and will be for the near future. So I miss out. There are people that shoot for a 100-day ski pin. I skied 13 days this year. And again, most people ski somewhere between 40 and 50 days. But I don't feel remiss. I don't feel like there's something missing because I get satisfaction out of what I do. If you're not one of those people who likes to listen to old European people talk about what life is about, there is scientific studies that show that if you pursue fulfillment, if through your life what you're looking for is doing things that are valuable, that mean something as opposed to others, as opposed to things that are exciting, that you're actually metabolically, genetically, emotionally, psychologically a healthier person. There's a guy called Arthur Brooks who made it to the pinnacle of academia and found himself unfulfilled and didn't want his daughter to do what he did. He's starting to write a column in the Atlantic magazine and about seriously happiness. And his argument about work is that to be happy at work, it's not about making more money. It's not about having your job be glamorous or anything that you would consider extrinsic, prestige, promotions. There has to be this intrinsic motivation. You have to feel good about that. What you are doing means something, that how you achieved your success was earned, that you worked for it, and that it actually serves others. That's the core definition of orthopedics. And that's actually the core definition of Harborview UW trained orthopedists. We work really hard. We've earned it. We're all successes in our own way. And we serve others, whether we're serving our attendings, our patients, our team, private equity group, we're still serving other people. And if you can reflect on that, it really makes you happy. Now, with this core idea of like, all right, I've got this life plan. I'm going to live a certain way. I'm going to make sure I check into that. And I'm going to make sure that I don't tie my happiness to excitement and titillation, but really to value of my existence. It is super important to take control, because if you don't, life can get really out of control really fast. Happened to me, happened to my mentor in fellowship, in that where you'll find yourself really, again, not in control. And to me, that's the core of a burnout. To me, that's probably a source of depression, is when you just give in and feel like, I can't control my schedule. I can't decide on what type of patient I'm going to operate on health-wise. I don't have control over that. I don't have control over my income, my mortgage. And if we can seize control, we can find happiness every day and looking forward to work, because we know it's going to be what we want it to be. Unfortunately, that too, early on, takes a ton of investment of time. I'm what's known as a micromanager at work, but it's because I believe in the principle of control. I manage my schedule really acutely. I have a start set time every day. I have a set time that I leave every day. There's a set number of patients that have to be seen during that time. If we're going to add on a trauma, which we often do, or someone who needs to be seen for a problem post-op, patient has to be added on either before we start clinic or after we start clinic, over lunch, but never overbooked, because it's not realistic for me, the way I practice. I spend a lot of time talking to patients in the room. It's not realistic to just squeeze someone in. I'm not going to rob the people that were scheduled. Similarly, I have color-coded every one of my surgeries. They're red or they're green or they're blue. And I don't want to do 2 red complicated surgeries in a row. I don't want to do a pilon and a tibial-talocalcaneal fusion back to back, because it'll not only exhaust me, but it'll exhaust my team. And there are certain cases I don't want to do on the same day. Again, it's super micromanaged. But if you surround yourself with people who care about you, they'll follow your wishes because they respect you and they understand that you want to be successful. This idea of taking control and being sort of a manager of what you can control is not unique. Similarly, the Stoics, who are having a moment right now because of this guy called Ryan Holiday, their key to success and a happy life was, number one, don't wrap your emotions into things that you can't control. And that's really hard to do. But number two, and more importantly, do control the things that you can. And take responsibility for those. Another way to put that is Stan Lee's comment that with great power comes great responsibility, or if you want to get more fancy, Sartre said, and his was in response to the fact that there's not a metaphysical reason for existence, and there's no God telling us what a good life or more life is. He argued that you define what that is, but that makes you responsible for what you do. It's the same at work for me every single day. I'm responsible for if I run an hour behind and my patients are late to their next appointment or late to pick up their kids. It would be easy for me to say it's not my fault, and that's just medicine. But I have found by being a micromanager and being consistent about it and being kind about it, I find that I can make it my fault if I'm late. And then when you bear that responsibility, you actually can be a popular doctor, because truly people come see me sometimes because they just know that they're going to get out on time. There is another foot and ankle surgeon nearby and another one in my own practice an hour away who's world famous. And yet my practice is built. I see more patients, do more surgery and generate more revenue than a person that really has a much better national reputation. And I think the large part is the patient care experience in the room. And again, it's not an accident. It's a ton of work that goes into making sure that that experience is curated. Taking control is of vital importance to being happy and looking forward to showing up, so you know that your day is going to be the kind of day that you want. It also involves being surrounded by people that you care about and who care about you. Again, just a normal human thing. And if you're going to spend 60, 70, 80 hours a week at work, You want to make sure that it's similar to what makes people happy at life. And so I have 3 direct staff, and we take care of each other. My assistants have been working with me for 7 years. She had an issue with daycare when we built our new office that was 30 minutes away. She had an issue with being into clinic on time. And so I found her a daycare and paid for her daycare. And that's, money out of my pocket, but it's money well spent, because A, it allows her to come to work, which is exceedingly important to me, but B, it allows her to know that I care, not just about my own job, but about her family. In the operating room, I want people to look forward to me being there. I want them to look forward to me showing up in the morning and doing the cases I do. Again, it's part of the micromanaging, but if the staff at the OR have a choice, so they say, they choose to be in my room, partly because it's predictable, partly because I play good music, but partly because I treat them with a lot of respect. In fact, there's a woman who was a tech who's become the foot and ankle ortho coordinator. No, I'm a foot and ankle person there, and her job really is to make sure that my cases go well. I'm down to 1 OR day a week at the hospital since we moved to an outpatient surgery center. And yet they have this full-time person who's committed to my practice and making sure that one day goes well. Which brings me to knowing and asking for your worth. Sometimes when we go to work, we can end up like Chuck D, who came and spoke to us at college. And since I reviewed the hip hop music for the magazine, I had to attend this lecture and learn from him. And I thought I was going to learn a lot about culture and music. But what I learned about is how mad and frustrated you can be as a human being, even if you're a big success, if you don't feel like you're getting what you're worth. And at that time, he spent 3 hours telling us that he was being exploited by the music industry, not earning the money that was coming in. And you can feel that way when you're in private practice. There's this concept of overhead, and you hear your friends talk about it. It's in the literature, and there's these various numbers as to what's fair overhead. I can tell you right now, I pay 85% overhead. What comes in receipts based on my name, 15% of it is what I get. But that's what I'm worth. It's what it takes for our practice to succeed. And frankly, that's what I think I'm worth. Now, at some point, that's going to change, I'm pretty sure. In anticipation of that, yesterday I asked for a 10% raise in my income from the group. I've never asked for a raise before in my life. Really uncomfortable. And it's a private equity group manager I had to talk to. I wasn't talking to Dr. Philippon or one of my managing partners. I was talking to a business guy who's trying to sell our practice in the next 1 to 3 years for 12 times our cash. And I asked him for a lot of money. And I thought for sure, the initial response would be, forget you and the horse you rode in on. They came 75% of the way in the immediate conversation. We talked for about 2 minutes. 2 minutes in, they offered me 75% of what I asked for. They started with, you guys are an incredible success. We knew you'd work hard. You've worked harder than we ever imagined. You're working harder, doing better than somebody who's been here a long time. We can't afford to lose you. And then the CEO of the hospital sent me a text and said, we know that you're looking for a certain number in order to make it work in Aspen because of cost of living, COVID, et cetera, kids in college. We'd like to come up with the other 25% to help you. What do you think you can do to help grow our business? And so within about 10 minutes, I bumped my salary about 10%, just asking for it. But when I asked for it, I gave them the numbers. I told them, I said, I do this many cases. This is how much revenue I bring to the hospital. This is what I'm worth in the real world. I'm not going to leave. They don't know that. I hope they're not listening. But I established a worth through through a lot of work. And I'm willing to ask for it back. But I'm not asking for it because I want more money. I'm asking for it because I've got 4 kids, and every one of them wants to go to fancy private school. And I know how much that's going to cost. And I know COVID robbed me a little bit of it. And I was also very, very explicit about why and what I needed. And I'm not bitter. And it wasn't a value judgment between them and between me. Once you get to that number or to where you're at, no matter how many surgeries you're doing, no matter how much revenue you're bringing in, no matter how many days you ski, there's always going to be somebody who makes more, works less, has more fun. It's just a fact. If you focus on those people, no matter how cool your job is, no matter how great your relationships are, you will find yourself going down the spiral of unhappiness. As I mentioned, there were 6 of us in the hospital employed group. They deliberately kept 2 of us. They let 4 go. One of them stayed in the community, works 45 minutes away. He's hospital employed. He makes twice what I make. He works 4 days a week, no call. He owns a home that's a villa in Punta de Mita that's so expensive I couldn't rent it off him to stay there even for a single night. And if I focused on that, and trust me, he tries to make me, I'd be super unhappy. Instagram, TikTok, Facebook, every chance he gets. And we're friends, but he reminds me that like he got the better deal is what he thinks. And yet he asked if he could join our group because what he sees is that we have a great life. We're in the same community. And so on the surface, like he won and I lost, but not really. And so it's super important in private practice, not to say like, am I earning the most? Am I doing the most cases? Because they're going to make you feel that way. Our practice manager every month sends out a comparative, rubric of how everybody's doing. And it's kind of a drug to watch your numbers grow relative to everybody else's. I've had to learn not to look at everybody else's number. And I specifically asked not to receive those. And I monthly only receive my report. And I compare myself to myself. And I compare myself to what I need to accomplish for my family. The final, I'm stuck. I don't know the final thing that I think is important is to remember that what we do is super cool. And sometimes you forget that because you're surrounded by people who do it too. And oftentimes you're surrounded by people who do it really well. And you may take for granted the fact that what we do is important to the community. And this is our daughter. She just graduated last year. She's a freshman in college, just finished her freshman year. And we've not made orthopedic surgery, being married to an orthopedic surgeon, not made it look easy. We've missed out on a lot. Kids don't travel much compared to their friends. Our daughter's best friend has a private jet, second home in La Jolla, and actually took her there on the jet when COVID happened. And that's where they spent their first 3 weeks of COVID online learning and I dropped her off, at the jet, on the jetway, and watched my kid go off while I had to, continue to work from home. And I thought for sure, because A, she's 1,000 times smarter than I ever will be, and B, that we gave her opportunity that she wouldn't want to be a doctor, truly. And she's a pre-med, wants to be a surgeon. And this summer she's coming home, doing an ethics project that she got some money for, and she wants to spend it with me in the office, trying to navigate some ethical things. Like I don't see as much Medicaid as I probably should. I'll only see Medicaid that's in our valley. I get referrals from all over, all 50 states and definitely within the state of Colorado. I don't see the Medicaid referrals that don't come from within about a 50-mile radius of where we live. And that's hard for me. And I talk about it at home because those are the people that need me the most, I think. They're down on their luck. She wants to talk about that in her fellowship and how I changed when I became private practice employed after being hospital employed, that I stopped seeing as much Medicaid. I can't run my business when I'm only getting 15% of the revenue Medicaid. The fact that she wants to do what we do, and when I asked her why, it's because we live in a small town in a community where when I go to the school or I go to the bakery, I go to a restaurant, I've literally had somebody tell me that I'm a celebrity in town. And it's funny, I'm not a celebrity in town because seriously, like Michael Jordan comes to town, the Kardashians and the Jenners are there. And it was a valet. And we went to a very fancy dinner. We took our friend from college to a really nice dinner. We wanted to show him a good time, but we parked far away from the hotel because I didn't want a valet park. So that's me. And the valet is a guy that knew me and he's like, dude, you should have let me park your car. Like, I'm not that guy. You're not parking my car. I can park my own car. He said, Waqqar, Dr. Khan-Farooqi, you're a celebrity in town. It would be an honor to park your car. And my daughter sees that. She's with us because what we do really matters to a lot of people, more so than being in finance or an influencer or an NBA basketball player, whoever else happens to be in our town. And so I would say if you leave academics, you're not going to be surrounded by residents and medical students, but try your best to surround yourself with them. I try to have a high school student shadow me pretty much all year, mostly because they make me feel cool. Seriously, that what I do feels amazing. And I know, and I hope that when I was in training and when I was a resident, I let all of you guys know that what you did was really cool. And I wanted to be like you. And so to make it work, take control, surround yourself with good people, including young people who look up to you. And I promise you, you'll look forward to going to work every day to the extent that it's possible in our system. With that, I'm going to pass on to somebody who I think is a lot smarter and actually is the reason I trained here. Thea started here a year before I did, and I was the boyfriend. And they didn't want to let her get away. So they took a chance on the kind of nerdy guy from Stanford. And it obviously worked out really well for me. Now, Thea is going to talk about sort of what makes it work for her.
And I have a little bit of a different perspective than Waqqar. I never worked full time. I love orthopedics and I loved working hard, but because we were two orthopedists together, sorry, I'm about a foot shorter or more. Because we were two orthopedists together, I couldn't really, and we wanted to have a family and there were a lot of things in our life that we wanted. I kind of had to concentrate more on the life. And so I feel like I compromised a little bit more than with work than maybe I would have if I was on my own. I too have kind of the same influences as Waqqar, including the Bogus Basin Ski Education Foundation, which informed where we finally ended up. There's been a lot of talk about burnout in orthopedics, and especially recently after COVID, more and more people have studied this. And are there things we can do to help prevent burnout? And I'm sure you guys have seen these articles from CORE. This is not something that's new in orthopedics. People have been writing about it since I graduated residency. There's a lot of stress. A lot of what we see in training and in practice can lead to burnout and stress, both within the orthopedists and with their spouses and significant others. When you're young, you don't have many worries. There are not a lot of things you think about when you're trying to balance your life. You think about, can I get a pet? Can I have some food? Can I go to the dance? Can I stay over at my friend's house? But as you get older, there are more things that come into play. You have to worry about those kids that want a dog and tell them why they can't have a dog. You have to worry about, am I doing enough being there for my family? Am I doing enough being there for my patients at work? I would argue that rather than thinking about balance, I think when I think about balance, I think 50-50, 50% work, 50% life, 50% fun. But I think that's the wrong way to look at it, because if you, especially earlier on in your career, as Waqqar mentions, often you have to work more than maybe you would like to set things up for you so that you can have whatever you consider to be balance in your life. And so I would argue that satisfaction is a better word to use rather than balance. So I don't know why my slide's not working, but most importantly, I think you should say, there we go. You should think about integrating your work and your life rather than balancing it. And at times you'll be working more, times you'll be with your family more, working on your health more, being with your community more. And all of that the timing actually and the amount doesn't matter. It's more integrating it all together. People sometimes think they want the 1 minute workout, but really there's a lot of preparation that goes into that. And a 1 minute workout is not 1 minute. It's usually 15, 20 minutes because you have to warm up and cool down afterwards. And sometimes you'll have, these are some cows that were moving from their summer to winter pasture where we live, while I was trying to drive somewhere and I was late with my kids. And so you have to be ready to change, and change in practice, change in life, which is kind of what we did. I'm going to talk to you a little bit about my perspective as a female orthopedist. It's a little bit different, I think, and I'm really happy that there are more and more women in orthopedics now. I recently read that there are 19% of residents are women, and I'm hoping that that will be more and more, and then maybe more people can kind of follow the different pathway that I took in orthopedics, not so much as Waqqar did, but differently. And I have hope that we'll reach parity at some point. There are a lot of bears where we live, so these are right near our house. They come every day. So most importantly, I think you should always be curious. Don't be afraid to pivot or change what you do. in work or in life. Residency is hard work, as you guys know, a lot of hours, but it's exciting and you learn a lot. And I really enjoyed my residency, and hopefully you guys are too. You have some great people teaching you, and there's so much to learn. Post-residency, as Waqqar mentioned, initially can be more difficult. You're out there on your own. If you go into private practice, you don't have the support of all the residents and the faculty, and you have to figure out how to do things more on your own. But you can continue to make it rewarding. And I think, especially if you want to take the path that I did, which was working part-time the whole time that I've worked, you need to be very strict about setting boundaries on your time, but you can still do it and you can still be valuable to your community. It's important to know and be honest with yourself. Are you someone who is comfortable with uncertainty? Are you someone who needs to micromanage? And then that should inform what you do with your practice, and then you can align your work and your life with your comfort in that. I think the reason Waqqar and I worked so well together is I was fine with uncertainty. My favorite thing was the trauma, because I liked it because of the variety and you never know what you get. I couldn't do that, I knew, because we were going to have a family. So I chose just to be a generalist. And that really helped us when we were moving jobs, because I just fit in and I would change and learn something new, whichever practice I was in. So I was always, even though I was working part-time, I was valuable to the practice. And again, for me, being a generalist was fine. I have no problem learning new things. And I think the only thing I did the same towards the end of my career was soft tissue management. I taught myself how to do an a direct anterior approach to a hip. And as hard to remember as when I was a resident, I was very afraid of doing a total hip, because I had one case with him at the VA where broke the femur and the hip dislocated. And so for a long time in my practice, I didn't want to do total hips, but at the end of my practice, that's what I did, was total hips and direct anterior, something I had never learned here in residency. Most importantly, I think in building a good work-life balance or satisfaction is to make sure you have a good community, both in work and at home and surrounding yourself. This is a throwback picture to all my residency classmates. I love them all. I think we worked really well together in residency just because we integrated our families and boyfriend, girlfriends, families, and work. And so if there was something cool that we saw at Harborview or at the U or at Children's Hospital, we'd call the others and have them come see. So we all learned it together. I really learned a lot about community in our current place we call home. The school there, which is a public school, is very good about getting the kids to build community, putting them in difficult situations. And they start in kindergarten. They go on these trips, and then getting them to work together, regardless of if they're their friends, and they actually try and put them in groups without their friends. My favorite is these, the pictures all the way on my right here are of a trip that the kids take in 8th grade. They hike from Aspen to Snowmass, or Aspen to a town called Marble, which is about 25 miles away. They backpack and they spend 24 hours on their own with just a tarp and some water, reflecting and having to write notes to their parents. But they come back looking like this, very happy. Our daughter, down here, before she went on this trip, she did not like backpacking. She did not like hiking. She did not like doing anything by herself. And it literally was a life changer for her. And so that experience in the school has really taught me that community is the most important thing for me. So I want to kind of switch gears a little bit here and tell you a little bit about how we manage. You know a little bit about where we went based on what Waqqar said, but as a part-time orthopedist, maybe one of you will want to do this. You can maybe follow along with what I did. Early on in your career, as I mentioned, you have to work a little more, read a little more, because you're on your own. If you're in private practice, you don't have the support that you had in residency. You have to get comfortable with your skills. And it's a time to discover what type of work and community you enjoy, and don't feel like the first place you go, you necessarily have to stay there. If you're lucky enough to land in the place you want to be, is great. What I learned from my initial work I did locums at first because Waqqar was behind me in training, so I had to wait for him. We had our first kid when I became pregnant in chief year of residency, and I had to learn to pivot in residency because that was the change from no restriction on work week hours to the 80-hour work week. And I had initially planned to end at the VA hospital when I would be most pregnant. And unfortunately, I had to still take trauma call, which was great. I had a great time and learned that I could actually do that many, many weeks pregnant. And that informed me later in my career. And then when Waqqar went to fellowship, I reached out to a group about 70 miles away, just cold called them and said, this is what I can offer you. And this goes back to Waqqar saying, you know your worth and know. And I said, I know you guys need someone to help you here. I'm willing to do this. I can't take call at the hospital because I live 70 miles away, but I'm willing to talk with the ER and talk with the hospitalists. And I arranged a practice where I could take call from 70 miles away and come in. Anything that was acute obviously got transferred, but I would hip fractures, ankle fractures, they would prepare for me and I could go the next day and take care of it. And so I really learned to, at that point, ask for what you want and you might get it. When we came back to Seattle and we're at the polyclinic, we had more children, 2 more children. The biggest thing I learned while working in Seattle was the job was great. I was doing mostly outpatient surgery. So I had time for my family, but the hardest thing was finding childcare. Previous jobs, my father had come and helped us with the kids. That made it easy. I didn't feel guilty about being away from them. But once we had more children, we were in Seattle, the childcare every year had to change. So at that point, we felt like the situation maybe wasn't the best for what our plan was for our kids. So we moved to Grand Junction, which Waqqar mentioned. So when you're I feel like this was my middle of my career, you kind of start to learn to do new things. You're comfortable with your skills. And again, because I was a generalist, I was able to morph what I did. I started to do more total joints and a lot more trauma because we were at the level 2 trauma center. So I was doing more cases that I really, really enjoyed. You also become more efficient so you can do more in less days. I worked 2 days clinic, a day and a half in the OR, and the call allowed me to do a halftime call. Most important, I found, again, you need to maintain your community. And in Grand Junction, it was the staff. This is where being a female orthopedist, definitely I feel like I had a different experience than Waqqar maybe did with his staff, because they would bring me into all the office drama. It was all women actually as our staff there. And I had to learn to step back from that. And so they wouldn't feel that I was their equal necessarily because I still had to be their boss. So trying to get myself out of the office drama could be a problem. I felt like I had a ton of support from my partners, both my husband and in the office, which was very important. And it seemed like we had reached balance. We were able to enjoy the area we were in, take some time for our life and for our kids' life. And I was still able to work and do the kinds of things that I like to do. However, we had another kid. The childcare was more consistent. We could have a nanny for 3 or 4 years, but we had another baby, and the community didn't value education as much as Waqqar and I did. And so we felt like maybe the community, even though it was balanced for us at work and at home, for our kids, it wasn't balanced. They weren't getting out of education what we wanted them to get. So at that time, a job came open in Aspen. And since I had been a ski racer and I enjoyed skiing, I said, let's take the job. And Waqqar listened. And so we moved to Aspen. And at this time, I was very confident in my surgical skill and what I like to do. And the job actually worked perfectly for me as a part-time orthopedist to balance life and work, in that it's so seasonal. I'd be really busy when the kids were busy with school, and not so busy in the summertime when I could take care of the family. And there were many things I like to do. I was able to be the team doctor for the local ski team. The World Cup finals came to Aspen. I was a doctor on the slope. So a lot of things in work that I enjoyed. And there was a lot of trauma. Oh, there we go. And this is an example of what you might see. So it's back to the soft tissue principles and things I really enjoyed from residency. But it wasn't 50 things on one person. It was one bone, maybe two at a time. So it was kind of civilized trauma. So perfect for me and in the way I wanted to practice. The community fit us too. It's an embarrassing picture for Waqqar. I can see him over here. It's a small town, but it has a lot of big city amenities. And even the orthopedists have to march in the 4th of July parade. And then important to us as a family and to our children, education is really valued in the town. We went to a Education Foundation dinner the first year we were there, and they raised $1 million for the public school, which that impressed me. So I felt like finally we'd found a community where I could do the work that I enjoyed, and our family could enjoy their time as well. And I want to note, since I've always been part-time, if you ever did the Maslach burnout scale on me, I never burnt out, which I know he did from living with him, but I think it was a good situation for me to be able to, I could work forever. I had such a great time with orthopedics and with my life. However, COVID hit and that changed the ballgame for us. Unfortunately, people still went out and they thought if they were positive for COVID, being outside and skiing, hiking up the mountain, skiing down, that was a fine way to isolate yourself, and then they would break their femur. And so this is a picture of me getting ready to operate on a guy who did just that. And then our practice, as Waqqar mentioned, changed and got bought out by private equity. So although we got to do a lot of things with our family now because of COVID, we took advantage of hiking the 14,000, the highest peak in Colorado, with all of the kids. We got to hike from Crested Butte or Aspen to Crested Butte, and these are some views of that. It's 11 miles away. Beautiful place, and there was no one there. It doesn't usually look like this. Usually there's a line of people walking there because the views are so popular. Work was starting to become unbalanced for me because of the pressures of money. I'd never worried about money. I was lucky because I was married to an orthopedist, so I didn't have to worry about how much money I made. So I could operate on patients or work with patients or do things that maybe my other partners didn't want to do, but was necessary. These people needed me, but it didn't really make money for the practice. Or for instance, working for the ski team, that was completely uncompensated. But once the private equity group came into it, that was not valuable to them. So I basically was given an ultimatum. Either I needed to work full time or I could do what I did, but I would have no staff. And no staff meant no medical assistant, no scheduler. I would do it all myself. So essentially I would have been very imbalanced. And so at that point, I decided it was not worth it, even though I love orthopedics and I wish I could continue. We wanted to stay where we were because it was right for our family. So I retired and I've recently been retired, but not fully. I now work at the airports, get to be outside. This is a day where one of the private planes flew off the jetway. And so the airport was closed. So I was just driving around with my friend, gassing up all the equipment. It's a very different job, but very fun. And it's so that we can travel and see our daughter who's in college and do things together as a family. And then the girl who wanted a dog earlier, she got her dog. She got a cat too. So ultimately, what leads to balance or satisfaction? I think each person is different. Hopefully from my talk, you've kind of gotten an idea of a different way to do it. It's not common. Normally, since residency, you work so hard, you're constantly driving. A lot of people will do the same for their whole career, but you don't necessarily have to do that. You can still have a good orthopedic career and not do that. Each person is different. It's important to know yourself. If you're comfortable with, as I was, with uncertainty, then you might do better doing something more untraditional as I did. If you need to have more control and more of micromanager, that might not work as well, but you need to really know yourself. For me, ultimately, I wanted to serve my patients well. I wanted to make sure that I was continuing learning and questioning and stick to my principles. And once money became more involved and that became the focus of the job for me, I didn't feel like I could do that well. And so I had to step back, and that's all part of learning to know yourself and when to pivot and change. So now what I concentrate on is my family, my friends. There's a lot of interesting people I've met in living in a town like Aspen. It's important, again, to be adaptable no matter what you choose to do. If you choose to work 80 hours a week, that's totally fine. If you choose to do what I did, that's totally fine. There are many different ways to do it. But I think important is to enjoy what you do. These are some of the singers that we've seen at the local club near us, and they definitely seem to enjoy what they're doing. And then most importantly, besides having your community and being able to adapt, is to know when to compromise, know when to change, know when to pick up and go. And I put a throwback picture here from when I was a chief resident on trauma, pregnant with my first child, doing a pelvis case. But ultimately, you need to expect nothing. And if you expect nothing and just go with the flow, I think you'll have a great ability to balance as you want to do what you want to do, your life and work. And this is my favorite tattoo from a patient. I had to try and, he had a radial head fracture. I had to try and avoid the tattoo. So any questions for either me or Waqqar?
So just to remind everybody, they can also text me with any questions if you're remote. I have a question, but does anybody else have anything they'd like to ask? So this is for both of you. And that was a great talk, and I think a really positive and realistic message. So I don't want to tilt into negativity, but I am curious, to either of you have any regrets about choices you've made along this somewhat circuitous path that you've had?
I wish I could still work because I really enjoy orthopedics, but I realized for our family that wouldn't work and we couldn't stay. I could work, but we'd have to move. And where we are now is really ideal for our family. So, and maybe I would have done a little more trauma because that was my favorite thing from.
Yeah, I should add, and not regrets, but what would you do differently? I think that's even the better question.
To begin with. Yeah, because then I think we could have really built it up.
I think that's part of the life plan thing, not really having a focused idea of exactly where we want to be, what we want to do, kind of just going a little bit, maybe too much with the flow. I can tell you that what Howard described as our path, it really has been a circle. My first job here in Seattle is really analogous to what I'm doing now. I tried to find balance and happiness and work 4 days a week, hospital employed. I tried to find a different way to do it where it wasn't quite so consuming. And I didn't have to put as much time, maybe an effort and exhaustion, frankly, into being a really busy, happy, productive surgeon. And I think I would have, I wouldn't do anything differently because I'm super happy where I'm at now. But what I've learned is my first job was as good a job as I have now. It was up to me to make it work. It was up to me to understand this business. We would have meetings where we didn't talk about necessarily quality, like how do we become better surgeons? How do we do better work? It was, how do we make more money? How do we build the business? And to me, I thought that, because that's not what we do here. We talk about principles and how to fix the smashed per troche. And I wanted to have those conversations with my group. Those were the given. We talked about business. And now I realized you have to, because you're running a business. And my not regret, but my learning point in moving around was you got to be willing to accept that it's a business and not run from it, but embrace it. And wherever you go, there you are.
And or decide that you care about the business, but you don't care how much you make. And so if you don't care how much you make, you can make the job whatever you want. And I was lucky enough to be able to do that.
This is a multi-part question from Al Bowie, who is one of our R3 residents. You both discussed the importance of knowing yourself and knowing your priorities. Once you figure out what is important to you, how do you find a practice that aligns with those goals? What questions should you ask and what is realistic?
Take this.
Yeah. Well, I think you should ask when you're interviewing for practice, you should ask for what you want. And then if they give it to you, great. So when we were moving to Aspen, I told the person I was interviewing with, I said, I want to work a lot in the winter and I don't want to work in the summer. Is that going to work? And surprisingly, they said yes. And so you don't know until you ask. But you do, I think, have to expect initially in your career that you're going to work more. If you want to do a part-time job, you're going to work more than part-time. It's going to be full-time if you were a finance person or 9-to-5 type of person, but it'll be part-time for orthopedics. You should also try and figure out what the culture of the practice is. I think that's very important that we kind of learned, and I kind of learned being a female orthopedist is some of the practice we worked in, being a female was great, no different than being a male orthopedist. Other practices I worked in, I definitely felt a difference. And for me, that was important.
I think one way is to use your network. We all know a lot of people and our attendings are good about calling. For example, I would ask Dr. Chansky, Dr. San Georgian, do you know anybody who is working in a practice that maybe has this set up or maybe was like this as a resident? And call that person, and then that person can end up calling another person that they may not be perfect for their group, they may not be looking, but use the network. I think that's a great way to find that job you're looking for. And then as Thea said, ask for it. I think I was in a resident mentality when I first started. I just wanted to be who my practice wanted me to be. And that's what you have to do in residency. You have to be what your team needs you to be, what your patients need you to be. While that's important early on, partly, it is going to be your life for 30 years, potentially. Ask for exactly what you want right away. Don't be afraid. And don't put value judgment behind it. I mean, it is what it is. If you are who you are, we're such different people, but we made it work in the same group. And and then review. It's so important to check your results when you're in private practice because you may not have a database that you plug into, but you have to be willing to review how you're doing with your patients. Do the same thing with your practice. I sit down with my practice manager regularly, quarterly, and we review how I'm doing, but I also reflect that upon how I'm doing in my practice. And if it's not working, I change something, and 3 times I change jobs. I wouldn't do that.
Really. You guys alluded to here, just
Thank you for a great talk. That was really awesome. You guys talked about private equity, Oh, sorry, I'm Talif. I'm one of the chief residents. So I was curious what your thoughts were on the private equity taking over. I've heard a lot more practices are being, taken up by private equity. Do you see that as a positive? And I guess what changes in the practice have you noticed since they've taken over?
I can speak without emotion, I think, which may or may not be important in this situation because private equity will generate emotion. I was warned not to join by a neighboring hospital that offered me a ton of money not to join. I didn't take it. So number one, private equity is really helpful because they're a bank and they have unlimited sources of money. That building that I showed, it's the premier building in the state of Colorado. I have a beautiful office. Our surgery centers are amazing and we can pay our staff a lot of money. We do that because we have an investor. So we've built a product that's unparalleled in our state and really in our region. And that's part of why we generate patients. But when you have an investor in you, you're beholden to that person or that group or that entity, and you lose some autonomy. If happiness and not being burnt out, not being depressed is control, and you give some of that because somebody's going to give you a ton of money to build something that you couldn't build yourself, you got to understand that you've ceded autonomy and control on some level, and that changes how you get your own control. And I think that they've been a positive overall with a product that we provide in our community. When we were hospital employed and when it was private practice, work ethic just wasn't there. The community was getting a raw deal, frankly. And then in came some people who were willing to really work at a different level. with some backing and some other people. And the hospital and the community would tell you that it's a better deal. The doctors went from 6 to 3.5 and then 3. I think they would tell you it's been rough. We work our butts off, probably more so than we want to. We're envisioning it growing. And then the private equity group has no sense of the future of this practice. They are looking, I don't know if you know what EBITDA is, they're just looking at cash flow. They get X amount of cash flow. They want to sell the business for some multiple of cash flow. And their goal was 14 times EBITDA, which 5 to 7 is the industry standard in any business. They thought they were going to sell for 14 times. And when that buyer didn't come, they got net stressed out and nervous, didn't take an offer at 12, roughly. And that's their business model. And it's not evil. It's not wrong. It's their business model. And again, it's elevated but they're not thinking about how where we're going to be in 5 or 7 years necessarily. We have to force them to think that way. And again, you can't judge them or get mad at them and throw your hands up. You've just got to force them to do that by having your conversations with them. It's like anything else. There's plus and there's minus. And it's really important to not just only see the plus and take it, see the minus. If it's coming, work with it, make the most of it. I wouldn't put a value judgment behind it though, necessarily, but it's made my life harder.
Yeah, definitely. And that's the reason I stopped practicing, because I couldn't envision myself doing what they wanted me to do. And so it made it harder for him, but actually easier for our family.
Any other questions from the residents? Steve?
Go ahead. Billy. Thanks.
Can you hear me?
Yeah.
Yeah, this is Vince Mosca. Thea and Waqqar, it's great to see you. Really great. I'm just so pleased to see how you two have figured out so early in your careers what is important to you. It takes people a long time to do that, I think. And I think you've done it better and earlier than most. Based on what you know, and also based on the fact that you're probably not typical, what do you see for the future of private practice? Burnout is at a rate that is unsustainable. We won't have orthopedic surgeons because everyone's going to be dead. But what do you see from your standpoint for the future of private practice? What's it going to look like?
Well, I'm hopeful that the whole private equity thing will burn out fast and hard. So it'll go for 10 years and then we'll figure out it's not really good for medicine. Business wise, it's helpful, but it's not really compatible with medicine. And when we have to help people that don't have money, you can't have private equity backing you because those people won't get the help that they need. So I'm hopeful that part of it will die. But I think private practice will still be around if we can be strong and direct the course of orthopedics. I think it will still be around for a long time.
I think personally, I think the idea of a small town, small independent group trying to make it is gone. The expenses for electronic medical record, all that stuff, rent, it's all just too much. The compensation we get from insurance companies isn't growing, it's shrinking from Medicare. We're going to have more and more people on Medicare and Medicaid type products. So I think that's gone. You're going to have to be, I think, part of a bigger organization. It's just the fact. Private equity is one of those organizations, hospital groups another, HMOs another. It's important to decide which dance partner you want to choose. And again, not necessarily as a value system, but as a life plan system, because the private equity group's going to, demand a certain thing, but you're going to get a big return on it potentially. And so then maybe do you retire a little bit early? Dr. Mosca, your question is a very important one, and I wish I were more of an expert on that. But my personal vision and impression is that we're all going to be employed by somebody or someone, and I think it's important to choose who that employer is.
Great, thank you.
Thank you. It's great to hear from you.
You bet.
Hey, I'm Billy. I'm also one of the chief residents. When you changed your practices mid-career and maybe had to start doing cases you hadn't done in a while, did you take courses or work with your partners, or was that necessary to be comfortable with the change in your practice?
Yes, I definitely did. When we were in Grand Junction, because I hadn't done a lot in total hips in quite a while, I had a partner who was very gracious and did many with me until I felt comfortable with it. And then for doing the direct anterior approach, which I started doing when I was in Aspen, I taught myself, I went to a course, a cadaver, to practice on the cadaver before I did it, obviously but there was no one else there that was doing it that way. So I had to teach myself.
Similarly, I frequently used to go to courses, but I don't like traveling because of our family. So I'll ask a company to bring a mobile lab, sawbones, and I'll do, like, total ankles weren't a thing when I was in training, necessarily not a big thing. And so I do practice a lot. I make sure, whether it's a new implant, which, the implants I use now are so different for some cases than I did in training, so different, that I don't necessarily go to courses as much. I try to get the courses to come to me. And we're fortunate at the Steadman Clinic that we have a lab that, it's funded and we can do stuff. I think that's an important part of staying on top of things and feeling comfortable. There's a lot of cases I don't do it at all similarly to what I did when I was in training here, but the approach is the same. The anatomy is the same.
Thanks very much for this presentation. I'm Stephen Kennedy. I'm the residency program director. A lot of what you talked about really resonated with me. So thank you for coming back and doing this. It's really valuable to faculty and also to the residents. My question is, you talked about being pulled in different directions, all the things that we have coming into our lives, and being present with our families at the end of the day. Do you have a system that helps you as a family to manage all of the different, things that you got to have to do? Yeah. Okay. Thanks.
I'm the system.
That's a great question. We're a bit more like Saturn rockets in the sense that we're just all over the place. But the key is that at dinner time, we've all kind of got to be together. We wait to have dinner until our last child is home. And right now that's 8:30 for our 12-year-old lacrosse player. That's when her lacrosse practice ends or when she gets back. And so I'm starving by 8:30 because I fast, because that's what residency taught me. If I want to be fit, I got to fast. So by 8:30, I'm ravenously hungry and we got to wait. And then something vegetarian. And then we then talk a lot about our days. And it's our chance to reconnect as a family. But I can't honestly say that we have we've got to go away on this. We have a recurring week that we do. That's a camp week that we do as families. So we have recurring weeks of holiday, but the system really is togetherness and talking about each other's problems and then letting our kids really run the show at the dinner table in terms of our conversation, which generally means Thea gets made fun of and I get told how unintelligent I am.
Guess they're all teenagers though.
That's a really good question. And if you have a system, I'd love to know what it is, because with 4, it's really hard. And you want to give them opportunity because your time with the kids is so short. But then your own energy level is waning a little bit too. And so you're trying absolutely to maximize their opportunity. And one day you look up and you realize I'm not raising my own kids. I farm them out to a nanny during the day, and then they go to a coach in the evening, and then they come home and I get about 30 to 45 minutes of time with them. I'm tired. I'm getting paged. And I have to admit, that's been my biggest thing that we've worked on. And frankly, part of why Thea was willing to retire was because we actually wanted to be there with our kids as parents, as opposed to having other people raise them, which happens a lot in Aspen, where people have the money to have.
And they don't work.
Yeah.
They have the nannies so they can go ski their 100 days, which.
I have one comment and then another question from a resident. So I had the opportunity through a friend of a friend to have dinner with somebody in the venture capital world who said they could not, from their perspective, understand the interest in even what are considered lucrative medical practices, orthopedics, ophthalmology, dermatology, because they said the scale of money that they're looking at just doesn't really fit the venture capital model. and they think that this is just a short sort of phase that's going to rather quickly come to an ugly end. So there is optimism for that. I guess if you're in a group and you're senior and you want to be bought out and retire early, as I have some friends that have done, that maybe isn't such a good thing. So this is another question from Dr. Bowie, and she says, you mentioned overhead and the learning curve adjusting to a system that is really driven by finances. How do you learn about that side of the business of orthopedics?
That takes a lot of outside reading and having a lot of conversations with. The way I learned it is, number one, I made sure that I served on committees, and I actually served on committees as a resident a lot. It's how it started. And when I got into my first practice here in Seattle, I started on the contracting committee and the surgery center purchasing committee. So I was in the room helping make decisions about the finances of the business. I then was on the executive committee of our practice in Grand Junction. So I knew the P&L, the profit and loss statement monthly. I had to learn the business side of things. I had absolutely no business training whatsoever, not even the slightest. So I picked up a lot of books. And nowadays online, you can read a ton. There's some websites and podcasts that give you business sense. But truly, it came during my time in practice. It wasn't something I was able to figure out ahead of time. And it was mostly getting down and dirty inside the business and running the practice and being nosy and a micromanager, frankly, wanting to know the numbers. And there was a time where I was thinking about going to Thea's hometown in Boise when we decided to go to Junction, be close to family, where if I hadn't had the training that I had had the first 3 years in practice, I wouldn't have realized that the practice that I was thinking of joining was being built by their practice manager. But the numbers made no sense. When it finally got to being offered a job and they opened up the books and I looked at them, it just was impossible to decipher what we were looking at. Number one, which is your first key that someone's obfuscating something. But number two, it's a sign that it looked like something was frankly wrong. And a couple of years later, they realized their practice manager was taking them for about $250,000 a year and had been doing so for a while. And so while I don't necessarily have an exact source for you to learn, I think the best one is by being really, really acutely involved in the business of your practice as soon as you can and learning from your practice manager or business people.
Yeah, I'm Zach. I'm one of the R3s. Sorry for being sorely underdressed. Thank you both so much for coming and talking, and particularly for kind of your insight, your philosophical insights and some of your kind of reflections on life. I was curious in particular, you spoke quite a bit, Waqqar, about your life plan and kind of realizing that it did or did not exist or how it changed over time. I've meditated a lot on, I guess, what I think I want out of life. And I'm curious a little bit about how you felt those perspectives and thoughts changed as you got out of residency and maybe what you realized you hadn't realized beforehand.
Thank you for that question. That's a really important one. And it's that's sort of been the crux of why I've read so much. I read a ton now, and I used to read a lot of orthopedics. I should read more, but I read a lot about that because I started out Muslim. My parents are from Pakistan, and I grew up in a very traditional Muslim home, and that was the code. Was, you just serve a certain way to live, and that gave me happiness because I felt like I did it well. And then college came, and it's very liberal arts education where I went, and that just confused the heck out of me. And so my life plan as I left residency was that I was going to be, a valuable member of the community, but B, I wasn't going to work as hard because I was really tired. So I bought into a version of what's called financial independence retirement early, FIRE movement, which bunkum, do not do that. You're basically saying, I'm going to make my life terrible so I can make my life terrible later. Because it just, honestly, it's not a good way to live because you're not happy. You're working way hard. You don't have what you want out of life. And then you're retiring to do what, really, exactly. And so what I learned is, personally, I don't envision a life golfing. I don't envision a life of being idle. I really like moving and working and thinking and doing. And so I changed from truly wanting to retire at about 55 to now not wanting to retire at all. I want to keep this engine going for as long as I possibly can because I love being an orthopedic surgeon. And if it is, I know that's not for everybody, and it sounds kind of weird, but I look forward to my days. I get to mountain bike because my job pays me well, and I get to live in a place where the mountain bike trail is 5 minutes from my house. And what I learned is exactly what Thea described. Was I thought the balance was work hard early, defer gratification, have gratification later. What I learned is it's integrated. I have my pager on, I'm on the bike for 45 minutes. And if I get called, I get called. Philosophically, it moved way far away from sort of believing that there's an absolute code and, a right and a wrong. That's absolute black and white. But my mission is the same. And that's really just make sure that my kids are my legacy, that there are 4 good people who are also contributing to the community, and that they remember that part of that legacy comes from the 2 of us. And maybe it's not necessarily what I'm telling them, but what I'm role modeling, in that sense. But the biggest change that I made was thinking that I was going to end up stopping working or work a lot less someday, and that was going to be happiness. And in Aspen, we have these really good friends, Jeff and John, really good friends who sold a lucrative business about 5 years ago, and they're retired. And they have this $14 million home that looks like a museum. They have all these showpieces, and they're unbelievably cool. And then they give you a tour of the house, your just jaw drops. And they travel probably about 46 weeks a year. They're somewhere. And I was taking a walk with the dogs with one of the couple, Jeff and John, just in our neighborhood. And they were describing a trip. And John said to me, he said, it's just not fun anymore. And they were going to watch Bruce Springsteen. And then they were going, I think, to Monaco or something just incredible. He's like, yeah, we're trying to just go through the motions. And so I realized that I'm not looking for that. I'm not at all looking for that life. I'm super just excited that what I do is important to the community, and that my kids see that it's valuable. And yeah.
I think me retiring has enabled you to work a little bit more, because when I was working and taking call, he would have to worry about coming home and being there for the kids, which you don't have to do now.
And honestly, that's helped me realize how much I do enjoy work, because I used to have to go. Like, I got to go. We got to finish. We got to get out of here. Now that I don't have that hanging over me, and I shouldn't say it hangs over me. Now that the responsibility isn't necessarily mine all the time, I'm not eager to leave. I want to make sure the work is done and it's done right, and my team is taken care of. And I can talk more philosophically if you want to.
So at 8 o'clock, we'll start getting parking tickets, and some of us are going to be late for the OR. My last comment is, you're not all going to have jobs in Aspen. Some of you will have jobs that may be more lucrative, but probably the majority will have something, a little sort of, I think, lower. I don't want to say lower tier, because my point is, it's all relative. You're going to have jobs where you're going to be respected in your community. You're going to make a better living than, 95, 99%, of your fellow citizens. You're going to do something that you're always going to find challenging, always going to be fun. So I think these are great points. No matter what kind of practice you're in, you have so much to look forward to.
And I would agree with you, Howard. The practice I kind of cold called and made myself in North Carolina when he was in fellowship. It was in a tiny town in Appalachia. So the main employer was Tyson Chicken. And so I had some very interesting patients, but I really felt that when I was there. I loved my job there, just because I was valued in that community, and I drove from 70 miles away to take care of this.
I learned a new word. Is it eudaimonic? Yeah. And so you're going to find that in any practice you're in. You're going to get a lot of satisfaction taking care of people. It's like we talked about with Dr. Nelson last week. The benefit, the internal satisfaction you get from taking care of anybody you can help, even if they're not going to be able to always pay you what you want. And the other thing I really liked is, try to not constantly compare yourself to what, other people are doing, what they're making, what you think they're thinking, because you don't really know, And so this was really great. And it feels so good to see the success you've had and the happiness you have and the family you've raised. And it's really great to have you both back here. So thank you.
Thank you.